Was sex painful the first time? Too much information. I wasn't as wet as I used to be before.
Say what you wanna say to me now. I wanna wake up with you in the morning. Show me there's nothing fake to me now. I wanna wake up with you in the morning. Say what you wanna say to me now. I wanna.
Hi guys, welcome back to my YouTube channel. My name is Linda. If you're new here, thank you so much for stumbling upon this video. But if you're a returning subscriber, you guys, I love you so much. This you already know. So from today's title, you already know what we're going to be doing today. So today we're going to be doing what really happens down there, and by down there I mean in the vagina after vaginal birth. Yeah, so let's get into the video. And before we start this video, kindly subscribe if you've not yet subscribed. So yeah, let's dive into the video. So today I'll be sharing with you my personal experience of what really happened down there in my vagina after my vaginal birth. Yeah, I did give birth to my son 6 months ago and had a natural birth. So first thing I'd love to say before we start is that people should normalize talking about these things. It's not a taboo to give birth, because every day a lot of women are giving birth worldwide. So people should just normalize talking about this and doing this topic more often and putting this information out there, because so many people do research on it. Because I found myself so in need of such, and I really did find a few people doing such, and I'm really grateful for them doing it, because I really had some idea of what to expect. And yeah, so it's really a vital topic. It's a sensitive topic, and somebody will be like, you're doing too much, you're revealing too much information. But yeah, you'll have to deal with it, because it's a normal thing. It's not a taboo. So let's begin with this video, and I'll start this video by sharing what happened to me after I gave birth to my son. So I did have a tear. I had a 2nd-degree tear, and what that means is that here is my vagina hole and here is my butthole, and this distance in between, that's where you get the tear. So I had a 2nd-degree tear, which means that the tear did affect the muscles of the skin and the perineal, and the perineal is just there. So the distance in between the vaginal hole and the butthole, that is the anal, that's where I had my tear. Okay, so that's where I had my tear. And after the tear, after my son was in this world, they had to stitch me up. And first of all, I should have mentioned that this tear was an episiotomy, and what that means is just that my doctor had to cut me. And yeah, so to prevent the tear from being so bad, he had to cut me, and this is what he do. So that's what we call an episiotomy. So after I had given birth, my doctor had to stitch me up, and couldn't feel a thing because he had numbed me down there. So it was a smooth process, and all I could feel at this moment was the sound of my son, because he was just from my womb, and I was so happy, and nothing else made sense. You just think to yourself that it was all worth it, because after you see the human that you brought into this world, you just know that you can do this and you'll recover, because so many people have been through it. So let's begin from that point. So my doctor gave me strong pain medication, and this really helped me because it kept me numb down there, and I was numb for a few days. I couldn't feel the pain, because when you're numb, you can't feel that pain. So I started feeling this pain after a while, but on a bad day, I could rate my pain as a 8/10, but on a good day, 5/10, which is not that good. So let me just be honest with you guys. If you're a mom to be, or you've not yet given birth, or you're planning to have a VBirth, a vaginal birth, be prepared, because this is what happens. And from my experience and from the videos that I've been watching, because I did watch a lot of videos concerning this, on YouTube, and the experiences are quite similar, although everyone has her own share of experience. So people are different, so your experience might be different from mine. So if you can relate to my story, kindly comment on the comment section below. Let's interact. So I've mentioned that I was given stitches, and the kind of stitches my doctor gave me are the ones that do dissolve on their own. Another thing, after you give birth, people do mention that they find it so hard to go to the washroom and pee, that is urinate. And I really thank God, because my experience on this was quite smooth, because I didn't have any complication. I was just okay. It was bearable. Yes, I did go pee, and actually they do encourage you to go to the washroom and urinate, because it's really, really helpful. It helps you to reduce the risk of infections. Yeah, so it's really, really important to go to the washroom to urinate after you've given birth. It really helps a lot. But so many people complain that it's so unbearable and it's so painful. But for me, I'll be honest with you guys that I didn't experience that pain. I was just scared, because I had watched so many videos on this, and I was prepared that I was going to endure a little bit of pain when I'm going to the washroom to urinate, but this was not the case. So I don't know if it's unusual, but that's what I experienced. So I didn't have any trouble with pain. So another thing is you'll be bleeding. Oh yes, you'll be bleeding, and you'll bleed and bleed and bleed. Oh God. So expect that. That's normal. It happens. So whether you give birth via CS, that is cesarean section, or via the vagina, you will bleed, and this is normally called the lochia, Lochia. So you'll bleed, and this is just normal, because all the constituent of that they are coming out. Everything that was in there, everything was there, including the fluids, the placenta, so they are all coming out together. So this kind of bleeding is just the same as the menstrual flow. The smell is the same. So the bleeding usually varies from one person to another. Some women will bleed for a few days, others will bleed for few weeks. So I personally bled for almost 1 month, let's say 1 month to 5 weeks. So yeah, so the first weeks it was so heavy, it's so normal. The flow will go reducing as time goes. So for the first 2 weeks I did bleed, but the flow was, yeah, so I did bleed. And after a while, after you finish that bleeding, you'll start seeing the color of your discharge is changing, and it will go from red to brownish to yellowish to whitish. Yeah, so that's what I experienced, and it's so normal. So this whitish, yellowish, brownish discharge is after a while. So I've said that most women bleed for 3 to 6 weeks. So yeah, the 6th week is when you usually have your appointment with your doctor. Most people do have that, so that's what happened. So by the 6th week I was done with the bleeding. And what got me through this, I have these maternity pads, maternity pants, because maternity underwears and maternity pads, this really come in handy, and it's part of the postpartum care. I was given these maternity panties at the hospital, and they are the disposable ones, so they really came in handy. They were so comfortable. They were so, yeah, you know that this time that you stitch and all that, you really don't want anything that is tight. You want something that is loose, something that is really comfortable and a bit loose, so that you're comfortable. And yeah, so this is what I used. It depends on the hospital that you're at. So for me, where I was at, the hospital did give me the hospital underpants or underwears or undies, or yeah, so I was given the maternity pads, the medical one, so they really came in handy. The first few days that I was at the hospital, I used to use 2 pads at a go, and would place 1 pad on top of the other, so yeah, so to make it a bit longer. So after a while I ran out of these particular pads, and I had to restock mine. So I went to the supermarket, or rather I did send, because at this time you can't even move. Oh God, your movement is restricted, you have stitches, you feel like down there it's so uncomfortable, so you really can't do a lot, and you're told that you should take some time off, you should relax, you should do more of the bed rest, because when you're too active, you'll start bringing yourself complications. So yeah, so I hope you understand that. So at this time, because it was the first week of recovery, I had to send somebody to get me the maternity pads. So I settled for Always. Was it Always? I think, yeah, Always maternity. Okay, let me just say I settled for another brand, and I got these, I don't remember the name, but they really were long enough, and I did prefer these other maternity pads to the ones that I was given at the hospital, which were the medical one. So if you've not yet watched my video on what's in my hospital bag, kindly go and watch it out so that you can understand what I'm saying, because I've shown you how the maternity pads look like, and I've given you the difference and how they really feel, and I have videos on how they look like. Another thing that got me through this entire healing process, recovery process during the postpartum, is that I was given strong pain medication, and this strong pain medication really came in handy. Yes, I was numb, but that medicine was wearing off after some time, which is normal. So my pain did increase, and I could feel the pain after 5 days, because the medicine that I was given, which was numbing my vagina, had worn out. So after 5 days, I could feel the pain, and it was so painful. I won't lie to you, it was very painful. It is very painful. It was, and yeah. So I was put on pain medication for 2 weeks, and this really did help me. So another thing that you should put in mind, I hope that your doctor will put you on stool softeners. Oh God, it's so important to have stool softeners, because God, it is no joke. It's no joke, because the first poop is so unbearable. It's so traumatizing. The thought of going to the washroom is so traumatizing. Remember, at this time you're supposed to be eating well, because you're breastfeeding your baby, so you want to have that milk supply, but you still have that fear that you have stitches, you really need to go to poop, and you've really heard that the first poop is usually unbearable, which is true. They don't lie. It's so painful, but with stool softeners, I really think they do help. So your doctor will put you in stool softeners, and if he doesn't, please inquire and make sure you are on stool softeners. It does help. So because you're in this postpartum care, the first weeks you really can't have sex. So for me, I really didn't have sex until the 3rd month, because the thought of having anything down there was so unbearable. I was so scared. Another thing that people do ask is, how does sex feel like after giving birth? So obviously, for some obvious reason, okay, let me just speak from my experience. I had sex after the 3rd month. Going back to that day, okay, that is too much information, but okay, so I don't know how to put this across. So for me, I did take my time to heal, because apart from having those stitches and all that, after 1 month, I did feel that I had recovered. I couldn't feel pain, and my stitches had already resolved. So after 6 weeks, I didn't feel any pain down there. I had recovered physically, but emotionally not yet, because you're still traumatized. You pushed a whole baby, and you really ain't ready for any other activities down there. You just want to take more time for yourself to be healed, and also it's good to take time to heal mentally. For me, I did take enough time for myself, and I didn't resume to any activity until the 3rd month, or even the 3rd, I think it was 3 months 2 weeks. Yeah, so that's when I felt like, okay, I can try it, or let me experience how it is. And honestly, from my experience, The first time it was so unusual, something was not right. I could feel that there is a difference, and according to me, I still feel like more of a psychological thing, and once you overcome it, I think you'll be okay. So a lot of people have been through this and people have survived, and once you're ready, it can take you 1 month, it can take you 6 months to resume, it can take you 2 months, 3 months, or however long it takes you. But each one of us has their own timeline, and our bodies do take different timelines to heal. And I did wait for 3 months, 2 weeks, and it wasn't an easy decision that I just woke up. And no, even after the 6th week, when I was going for my checkup, for my 6th week appointment, I was still like, the doctor was telling me, let's put you on the family planning. I was like, no, I'm not ready mentally, I'm not ready, and I'm not planning to have any sexual engagement until, yeah. I told him that when I'll be ready, we will come back for that particular plan, the one that you are going to discuss later. Once you've given birth vaginally, I would recommend for you to use the wipes. It's so important to keep down there. You don't want to be rubbing rough things, because it will irritate you, and it can cause infections and all that. So it's really advisable to use wipes when you're going to pee or you're going to poop, because apart from keeping it clean, it will also make you experience much easier. And yeah, another thing, take a lot of water during this process. It really helps with hydration. It will improve your milk supply, and it will also help you with going to the toilet, and yeah, frequent urination. People are advised not to have sex for the first 6 weeks, so that's it. But after the 6th week, if you're planning to have sex, make sure that you are on a birth control, the birth control of your choice. So that's really important. That's if you're a first-time mom or you're planning to give birth, because there is high chances for you to get pregnant again, and we really don't want that if you've not yet planned for it. So that's important. So another thing that I found really useful during my postpartum recovery journey is sitting on warm water, warm salty water. It really did help me. I don't know if this is a common practice worldwide or it's just in Kenya, but I had a lot of friends recommending it to me and telling me that you should sit on warm water, warm salty water, and it really did come in handy. I really felt, apart from cleaning you, it really accelerates the healing process. So that's really important, and this I used to do on a daily basis. So if you can do it twice a day, that's great. As part of this video, I'm going to be narrowing down what was really important for me during my postpartum journey and what exemptions I had. So for me, one thing that I'll recommend is to have your maternity pads, the maternity pads of your choice. So even if the hospital you're delivering at will give you, you'll really need to restock your own, because most people do bleed even after a month. So you should have your maternity pads. Another thing is your maternity panties, your maternity underwear. They should be so comfortable, so it not be tight. Another thing is the wipes. You really need wipes, because they will help you. Please do get yourself your wipes. The most commonly asked questions, one is, was the first poop painful? Yeah, for me it was so painful. I felt like I'm giving birth again, and you're also worried that you're going to tear those stitches that you were given. So I think it's as much as it's painful down there and as much as it's unbearable, it also comes with the trauma. You're affected psychologically, so much fear. You're worried that you're going to tear your stitches. For me, I was so scared, and I was so afraid. And my first poop was so painful. I felt like I'm pushing a whole baby out. So my first poop happened after 4 days after giving birth, and I really don't want to remember that day, because it was so painful. I can't even tell you. Apart from giving birth to my son, that's the most painful experience that I've had to endure. So yeah, it was that painful. So another question that people do ask, was the first pee painful? So many people complain that having to pass their first urine being painful, but as for me, I didn't have any pain whatsoever. So the only difference that I noticed was because I had stitches, I used to walk with my legs apart like a penguin, like I said before. Commonly asked question is, how long does it take to heal? So many people do feel that they are okay after the first month, but personally I felt better after 6 weeks from the time I did give birth. But the first month was so unbearable, from the bleeding to feeling the stitches after the pain medication has worn off. That was so unbearable. So another question is, so for me, I won't say painful, but it was unusual. Personally, I felt like I wasn't as wet as I used to be before, but this was just at that point for a few times, but afterwards it went back to normal. So I think it's normal. So that's why people should normalize talking about these things. We need to know, because people are always giving birth. It's not a taboo. So another thing is, you'll be worried if your vajayjay is the same after giving birth. Is it the same size? So personally, I'd like to think that it usually contracts back to the original size, and I think now it's even much better and it's tighter than before. So that's according to me. But I'm here to be real and to inform you, to educate you, and yeah, so I don't regret telling you that. So another thing is, how long did I wait to get back to such activities? So for me, I did take 3 months off and 2 weeks. So mentally, I was not yet prepared, but physically, like I said before, I felt okay physically after 6 weeks, but mentally, I was not ready for any activities until the 3rd month. We've come to the end of this video. I hope you enjoyed it. I hope you liked it. If you like this video, please give this video a thumbs up. Please comment on the comment section. Let's interact. And if you've not yet subscribed to my channel, please kindly hit the subscribe button, which is down below. And yeah, road to 1,000 subscribers. I love you. And also, if not for anything, imagine my sister is shooting me this video and it's currently 1 a.m. Imagine. So if not for anything else apart from that, kindly give this video a like and let's get me to 1,000 subscribers. Love you. Bye. Till next time. Peace.